So, the mission of the San Diego County Fall Prevention Task Force is to reduce falls for older adults in San Diego County. And the reason we care about that is because, of course, anyone of any age can fall. But when older adults fall, their consequences are more devastating. So we know that falls are the number one cause of fracturing a hip in older adults. And we know that people who fall are have a 50% chance of falling again within 6 months. So one fall can lead to the next fall. And then of those who fall and they're over 65, we estimate about 20 to 30% will sustain a moderate to severe injury that will prevent them from ever returning home or living alone again. And I can give you an example of a woman from my church who fell last year while she was home alone with her two cats. And she broke her foot and she got a head injury, a brain injury. So she got a bleed in her brain. And then she was never able to return home after that. So she ended up going to the hospital, going to a rehab center, and then moving into a nursing home basically to live out the end of her life. And it was very sad because her one wish that she told us was that she would be able to stay in her home and die peacefully in her home with her cats. And so at the end of her life, for the last 6 months or so, she was separated from her cats and her house because she had had a fall that resulted in severe injuries and she was never able to return home. So that's an example of what we're trying to prevent. So, Vanya, will you please pull up the slide on the myths about falls that we're going to start with? Yeah, oh, back up there. Myths. Yeah, right there. Good. So there's a lot of information flying around about how to prevent falling or what it means to get older. And we're going to start off this talk by dispelling three common myths about falls and aging. So the first one here is that muscle strength and flexibility cannot be regained. Now, we know that through normal aging, people get stiff and their muscles get weaker. So that is true about normal aging. However, through exercise, the research has shown that people can regain flexibility and strength. That's why exercise is so important when you're over 65 to combat normal aging and help to reduce the risk of falling. The second myth about falls that's really common is people think if they stay home, they can avoid falling. So, this is actually one of the first things that we see adult children suggest to their parents after one of their parents has had a fall. And they say, like, oh, mom or oh, dad, just stay home. Don't go out as much. I'll have your groceries delivered, and then you won't have another fall. But we know from the data from all the trauma centers in San Diego County that most falls occur by slipping or tripping on a level surface inside the privacy of your own home. And so, therefore, that's a myth. It's a myth that just staying home will prevent falls. And the third myth we'll address today is that falling is inevitable as a part of normal aging. And I would say that's not true. I certainly know plenty of people, older adults that are active. They go golfing, they play ping pong, they play pickleball, they walk 2 miles a day, and they stay strong. They work with their doctors to manage their health, and they're not falling. So it's not true that falls are inevitable and unavoidable. Now, we cannot guarantee, of course, that people won't fall, but we can take steps to reduce the likelihood that they will fall or reduce the risk. And that's what we're going to cover today with our talk on fall prevention with helpful tips. As I mentioned, there's some statistics about falls that are important. If you've had one fall, it increases your risk of falling again. And currently, we estimate about 1 in 4 older adults will fall each year. And I can tell you this has improved from when I first started doing this kind of work about 18 years ago. The statistics back then were that 1 in 3 older adults were falling each year. So I think we're being effective with our education and our outreach. We're getting the word out about what people can do to prevent falls, and therefore statistics are improving. So, we're going to cover helpful tips today on how to prevent falls. And as I mentioned, there's no foolproof, absolute way to prevent falling. Everyone is at risk of falling anytime, everyone at any age. Of course, I could fall just walking my dog today if I happen to trip on the curb. But what the research has found is that the more interventions and action steps that we take to reduce the risk of falling, it has an exponential effect on reducing the risk of falling. So it's not a linear effect. It's not a directly proportional effect that if you take a certain number of actions to reduce your risk of falling, it's a linear, directly proportional impact on reducing the risk. No, the research has shown that the more steps we take and the more actions we implement to reduce the risk of falling, it actually has an exponential impact on reducing the risk of falling. And that's because a lot of these tips are actually intertwined. And so you'll see that a lot of these things relate to each other. And so we're going to cover the helpful tips broken down into 4 categories today, just for organizational purposes. The first category is going to be about speaking up. This is about advocating for yourself when you're working with your healthcare providers, specifically your primary care doctor. The second category we'll cover today is keep moving. As I mentioned, part of normal aging is that we lose our flexibility and our strength due to normal aging of the muscles. So we want to keep moving in order to maintain or improve that. We'll talk about tips for that today. The third category we will cover is checking your eyes. And then the fourth category is how to make your home safer. So the first problem that people have is that certain chronic health conditions that we develop with normal aging can increase the risk of falling. And then it's traditional within our healthcare system to give medications for these health conditions. And then those medications for certain health conditions all have side effects. And then those side effects can actually increase the risk of falling also. The medications can interact with each other, they can interact with alcohol, and all of these things can spiral up to increase the risk of falling. So the key thing here is to make sure that you have a primary care provider that you trust. This might be a doctor, it could be a physician's assistant or a nurse practitioner. It just depends on your health insurance and the healthcare system that you're part of. But you want to make sure you have a primary care provider that you trust that's really doing a good job helping you manage your chronic health conditions and also looking at all of your medications to make sure that you're on the minimal necessary dosage of whatever you're taking and checking your medications for drug interactions. Here is an example of some questions you can ask your primary care provider at your annual appointment. You can ask your provider, can my medications contribute to a fall? Take all of your current medications and supplements to your healthcare provider to review. You can ask about possible side effects and combinations of different drugs and supplements you're taking. The second question you can ask your primary care provider is to conduct a physical exam of you to assess if your current health status is increasing your risk of falling. And if so, your provider can possibly make referrals as needed to a cardiologist, to an ophthalmologist, to a neurologist, maybe an ear, nose, and throat doctor, possibly a psychiatrist or a psychologist, mental health providers. You may need a referral to physical therapy or occupational therapy. So there's different referrals that your primary care provider can put into the medical system for you if you ask them about the different health conditions you have that you're taking medication for or that they're monitoring for you, and ask them if you need any referrals to specialty providers in order to reduce your risk of falling. The other thing you can ask about is nutritional supplements. Should you be taking any vitamin D or calcium or vitamin B, anything like that? And they'll be able to determine that based on your annual blood work. When you go in for your annual exam, your doctor or healthcare provider should ask you these three questions. These are actually required by Medicare during your annual wellness exam. One question is, have you fallen in the past year? And we estimate about 25% of people over 65 should say yes to that. Now, that doesn't mean you sought medical care for the fall. Maybe you didn't need to go to the doctor, go to the emergency room, or go to the urgent care, or call 911 after the fall. That's not the question. The question is not, were you injured and sought medical care? The question is, have you fallen? So this would include falls that have occurred when you're home by yourself, even if you're not injured. So you want to make sure to say yes to that question if that's true for you, so that your provider can order the correct services and referrals that you need to prevent a future fall. The second question is, do you feel unsteady when standing or walking? And again, this is a subjective question, but you want to be honest. Do you feel unsteady? That's a yes or a no. And if you do feel unsteady, don't minimize it, because we've seen that physical therapy referrals for people who feel unsteady are very successful in improving balance and walking stability. So you may just need a round of physical therapy to get your walking stability back and prevent falling. And then the third question the provider is supposed to ask you, according to Medicare, is, do you worry about falling? So are you afraid of falling? Those are the three questions that they typically will ask you during your annual exam. And then if you say yes to any of those questions, that will trigger them to do interventions to prevent falls. One of the challenges that providers have is that you may not be honest with them, and you may minimize that you had a fall. You may try to hide it. You may minimize that you feel unsteady walking, or you may deny worrying about falling. And so just make sure you're honest during this part of your annual appointment with your primary care provider, so that they can do the next appropriate steps in terms of accessing proper medical care to prevent falls. And so this is the part where you have to speak up and you have to advocate for yourself. The next general category we're going to look at today that happens to people in retirement is they become sedentary. So they think, oh, I've worked so hard my whole life. Now I'm retired. I'm just going to relax. I'm going to catch up on all the TV shows I didn't get to watch. I'm going to get into, Korean soap operas or whatever people like to get into when they retire. And they're just sedentary, meaning they're sitting on the couch watching TV most of the day. Now, the problem with the physical inactivity is it actually accelerates the normal aging of the muscles. So we want to make sure that we stay active in order to maintain our muscles and also improve our strength as we're getting older. The other problem that happens if people stop moving around as much is they develop a fear of falling. Or if they've had a fall and they didn't do anything about it, they just tried to ignore it or hide it, then they develop a fear of falling. And they can actually change their behaviors, lifestyle choices, and movement patterns due to a fear of falling. And so both of these things, both the physical inactivity or that sedentary lifestyle and fear of falling, both of those put you at risk for more likely to fall. So, in terms of keeping on moving in this section of the talk, the first thing is to look at footwear. Now, I had a lady at my church fell recently because she was wearing clogs, and her foot slipped out of the clog and it got caught on a carpet, and she fell and hit her head on a desk in the back of our church. And so I talked to her about it. She's 68 years old. She's actually a friend of mine. And I said, I don't think you should wear those clogs anymore. They're not safe for somebody your age. That's probably why you fell, because your foot slipped out of the clog and then it got caught on the carpet and then you fell and hit your head. And she sort of said, But it's just not fair. I've been wearing these clogs forever. How come now that I'm older, I have to change my footwear? I've always been doing it like this. How come now I have to not wear my clogs anymore? And so she sort of helped me realize how hard it is to accept the fact that, yes, because you're over 65 now and you're in the category of people that are more likely to fall, yes, I'm sorry to say, but you have to change your footwear if you don't want to have another fall. That would be the thing to do to respond to the fall that she had in the back of our church recently. And so let's take a look at the footwear here. Ladies wearing heels, that's generally not a good idea because your heels can get caught, like the clog got caught on the carpet, or you can twist your ankle. So your ankle can roll sideways in a high heel. You also don't want to wear shoes that are too heavy, like these boots in the middle of the screen here. These would be an example of shoes that are too heavy. They can throw off your balance, and the sole of this is too thick, so you can't feel the ground. Another example is dress shoes for men that have a slick bottom, like a slick, slippery bottom, is not going to be safe. And so, the best footwear to prevent falling for older adults is to choose footwear that has a thin, non skid sole that securely fastens to your feet. So all the way on the far side of the screen here where the green check box, you can see that these soles are thin, but they're also non-skid and the shoe securely fastens onto the feet. So for example, if you like to wear sandals or flip-flops, you can buy a pair of sandals or flip-flops that have a heel strap. And if you can put on sandals or flip-flops with a heel strap, that will prevent the shoe from slipping off your foot if it gets caught on the carpet while you're walking and then prevent you from falling. So it's really important to choose shoes that have a thin, non skid sole that securely fastens to your feet. And again, I want to emphasize even for lounging around the house, because we know that most falls happen from slipping or tripping on a level surface inside your own home. So I'm even talking about indoor footwear should have a thin non-skid sole and it should securely fasten to your feet. Now, the second key point about keeping on moving is that you really want to find a way to exercise as you get older. And I know this is hard because many of you have never had to exercise ever in your life and you lived a perfectly good, high quality of life without exercising. And I understand that. But the problem is now that you're over 65, your muscles are going to waste away basically from normal aging if you don't exercise. And I'll say this, my grandma at the end of her life got to a point where she was going to have to do physical therapy and occupational therapy pretty much every day to regain her independence after she had an incident with her heart failure. And she just didn't have it in her. She actually gave up the will to live rather than start exercising every day to regain her strength. And she basically told me that that's what she was going to do, and she did. And so she refused to exercise. And you know what? I understand. She did not want to do it. She would rather not have been with us, and so that was her choice. But, if you want to have a good quality of life and you still have the will to live, which I encourage, then you have to exercise when you're older, or else you're going to have a very difficult time with losing your strength and losing your mobility. That's just a reality check. It's an unfortunate reality check. So, how do you exercise? Well, if you know how to exercise, go for it. You want to make sure you have exercise that addresses four components: balance, strength, flexibility, and endurance. So this can be on your own, this can be with a partner, this can be in a group setting. You can do an online exercise. You can do the Feeling Fit Club in San Diego County. There's different sites around the county to do exercise with people. You could join a gym. Maybe if you're in a senior living community, there might be a clubhouse with exercise. So you just have to find something that you enjoy, or else you're not likely to stick with it. And if you find a friend who's willing to exercise with you, that can add some accountability to keeping the exercise on your schedule and not canceling. If you're not sure how to exercise because maybe you've never exercised before in your life, and maybe you just had surgery, or you have some kind of heart condition or some kind of other medical condition, then you can ask your primary care provider to refer you to physical therapy. So, physical therapists, we are like personal trainers who incorporate your medical and surgical history, and we can medically monitor you while you're exercising to make sure it's safe. And then once we get you set up with an exercise program that you know how to do and that is safe and appropriate for you, given your medical and surgical history, then we basically launch you to do the exercises on your own. And so you can go to physical therapy if you're not sure how to exercise, but you're willing to do it. You can receive physical therapy in the privacy of your own home through, if it can be through Medicare Part A, if you were recently sent home from the hospital, or if you've recently had a fall, or you feel unsteady with walking, so you're at risk of going to the hospital. Your doctor can order for you physical therapy through Medicare Part A. You can also receive in-home physical therapy through Medicare Part B, which is available for people with Medicare, whether they want to go to a outpatient clinic at a hospital or rehab center. They can go to a freestanding physical therapy clinic in the community, or they can have in-home physical therapy. Any of these could fall under Medicare Part B. And typically, the annual cap for that is going to be about 20 to 22 visits, depending on how they do your billing. You can also access physical therapy privately if you're willing to pay out of pocket for private physical therapy. That's what my patients do if they hire me, because I don't take insurance. So when I work with my patients, it's a private arrangement. I'm their private physical therapist, and they just pay me directly on a pay per visit basis. And there are a lot of physical therapists around San Diego that are doing that now. And for that, you don't need a referral. You can just contact us directly to schedule an appointment. So, those are different options for physical therapy, where you can receive it and how you can access it. I want to make sure you know that within the profession of physical therapy, there are specialists called vestibular physical therapists. So, just like your doctor could continue in school to specialize, say, in cardiology and then become a cardiologist with some extra and additional years of training, same thing within physical therapy. We have physical therapists like myself who have done additional training to become vestibular physical therapists. Now, what does this mean? This means that we specialize in treating dizziness, vertigo, and balance problems from the inner ear. Yep, that's the next slide is perfect. And when we assess you, we do something called a root cause analysis. We figure out what is causing your actual balance problem, what is actually causing you to fall or feel like you're going to fall or feel unsteady on your feet or afraid of falling. So we take a look at all that for a root cause analysis as vestibular physical therapists. The reason I want you to know that is because if you've already gone to physical therapy that was just a general physical therapist that just gave you basic exercises and strengthening for your arms and legs, and then you still felt unsteady on your feet, it's possible that you have an undiagnosed inner ear problem that a vestibular physical therapist could actually determine, figure out, and address that for you. So, most of the patients I work with that are over 65 and have chronic imbalance or unexplained falls have some kind of a condition that's undiagnosed that's contributing to it, such as crystals loose in their ears. That's what I treat most of the time, or say foot neuropathy, for example. So there's different problems that can cause imbalance that may be undiagnosed and thereby go unaddressed. So a vestibular physical therapist is trained to do that root cause analysis and figure out the root of your balance problem. They are going to do a hands-on exam with you to figure out the cause of your balance problem. And this is going to be superior to diagnostic testing in many cases. So, in many cases, people have already had, say, a brain MRI or a CT scan or cardiac testing. Maybe they've worn a Holter monitor. They've done all the basics. They got their eyes checked and all this, but no one can figure out why they're having a balance problem. So some problems that cause imbalance and falls actually don't show up on any diagnostic tests, and they actually require a hands-on exam to figure that out. However, in our healthcare system today, many patients are never getting a hands-on exam because their providers just don't have time. And so they're just relying on diagnostic tests, and the diagnostic tests in some cases aren't showing anything. And so I get a lot of patients that have no explanation for why they have a balance problem. And so I do a hands-on exam with my patients, and this is what all vestibular physical therapists typically do, is a hands-on exam if you would to seek their care, and then they can figure out the cause of your balance problem and develop a targeted treatment plan for that. So, how do you find a vestibular physical therapist? Well, you can start with this. If you know you have a problem with your balance, you can just go straight to a vestibular physical therapist. Or if you've already gone to physical therapy, general physical therapy for strengthening and general balance training, you can seek a second opinion by a vestibular physical therapist. And you can look up this website called vestibular.org. They have a healthcare provider directory, and you can search by zip code and find providers in your area. And there is a shortage of vestibular trained providers. However, in San Diego County, we do have a handful of them scattered amongst the different healthcare systems. So there's at least one vestibular physical therapist at Palomar, Tri City, Sharp East Steely, Scripps, UCSD. Each healthcare system in San Diego has at least one vestibular physical therapist that you could try to see. Now we're going to move on. We've covered speaking up when working with your primary care provider to manage your chronic health conditions and your medications. We've covered how to keep moving by selecting proper footwear, making sure you're exercising, and seeking physical therapy if you're not sure how to exercise. And now the third category we're going to look at is getting your eyes checked. So there's three things we really look at here with older adults. One is that people over 65 have the highest rate of eye diseases. So we're talking about glaucoma, cataracts, macular degeneration, and diabetic retinopathy. The big four eye diseases are most common in people over 65. So if you've been diagnosed with one of those, then you need to make sure you're following up with your ophthalmologist regularly. This is a medical doctor, an MD, that specializes in eye diseases. So that's your ophthalmologist. That's an appointment through your health insurance typically. And you want to make sure you're following up with them regularly to manage your eyes. The second thing is to make sure that you get your eyes checked by an optometrist at least once a year. Now, if you have unstable blood sugars from diabetes, for example, I've met patients in that situation and they get their eyes checked every 6 months. So your optometrist may recommend to you to come in more often than once a year, but once a year is typical for most older adults to get your eyes checked. And this is to make sure that you have the proper glasses, because correcting your vision is something that can reduce the risk of falling. And if you're wearing bifocals, trifocals, or progressive lenses, you have to take extra caution on curbs, steps, stairs, and inclines, because you could misstep due to looking through your reading portion of your lens, and then your depth perception could be off. So just take extra caution if you have bifocals, trifocals, or progressives when you're going up and down curbs, steps, or inclines, or stairs, because everybody is subject to normal aging of the eyes. We all are pretty much going to end up needing glasses as we're getting older. Now, first eye cataract surgery has been shown to reduce the risk of falling. So that if the surgery is a success, can improve and reduce the risk of falling. So that's just something to keep in mind. The fourth category we're going to cover today is making your home more safe. So, environmental hazards. Here's some examples: slippery floors, rugs getting caught under your feet, too much clutter blocking the walkway, and then inadequate lighting. Those are all common problems in the home that can cause older people to fall. So the thing is that we have research that proves that the time it takes to execute a balance reaction slows down as we get older. So for example, if you slip on a wet floor or if you trip on a rug, the quickness of your agility to respond to that, to take a quick step and prevent yourself from falling, is slower as you get older. So that's why older people are more likely to actually fall if they slip on the floor or their foot gets caught on the carpet. However, the research also shows that through balance training with a skilled physical therapist, people can speed up the balance reactions that they're able to execute when they lose their balance. So, even more reason to include balance training in your regular exercise or work with a physical therapist to train your balance. Now, one thing you may have noticed is that as you're getting older, you need more light to see things that you used to be able to see with less light when you were younger. But the older eye is also more sensitive to glare. And so, therefore, most older adults need to increase the lighting in their home and reduce the glare. So, you've got to find that happy medium between having more lighting but not having more glare. And then it's really common when people downsize from a larger home into a smaller condo or apartment after their kids move out to try to keep all their furniture and keep all their stuff. And then the apartment or the condo where they're living is too crammed. So if you can't walk through your walkways facing forward with the width of a walker around you, then you probably need to declutter your home. And I'm sure that's something you could probably ask somebody to help you with. So let's take a look at this handout. Go ahead and fly in the handout on this slide. So if you hit enter again, it should pop up. There we go. So this is the home safety checklist that the San Diego County Fall Prevention Task Force has put together for you. And Vanya has this available in a PDF format that she can send out to all of you after this talk. And you can take a look at it and inspect your own home like you're some kind of a home inspector. And just take this handout and look room to room and decide, is there anything you need to improve to make your home safer? Now, I will say they've done research to show, is making changes to your home a standalone intervention to reduce your risk of falling. So, for example, if you disregard everything we've talked about today, except making your home safer, will that reduce your risk of falling? And what they found is that making your home safer cannot stand alone as an effective intervention to reduce falling, but it is an important component of a comprehensive approach to reducing the risk of falling. So you still want to manage your chronic health conditions, get your medications checked, work with your primary care provider to get whatever referrals you need for specialty care. You still want to keep moving, select the proper footwear, exercise, work with a physical therapist if you need to. You still want to go to the ophthalmologist to get your eyes checked if you have an eye disease. You still want to go to the optometrist to get your glasses checked due to normal aging of your eyes. You still want to take caution doing curbs, steps, stairs, or inclines if you're wearing bifocals, trifocals, or progressive lenses. And in addition to that, you want to make your home safer as a comprehensive part of a multifactorial approach to preventing falls. Now let's look at some simple home modifications that many people choose that are not that expensive actually. So first of all, sitting down in the shower is huge. So you can get a chair or a bench. You can, if you sit down in the shower, you need to get a handheld shower hose so that you can control the flow of water onto your body. You probably want to have some grab bars installed in your bathroom and make sure they're screwed into the studs so that they can support your weight. If you just put them into drywall, then they'll come right out of the wall if you lean on them at all, and then you'll fall to the ground. There are some really nice grab bars these days that are what's called decorative grab bars. So they actually look like nice towel racks or nice toilet paper holders, but yet they screw into the studs and they can support your weight. So if you have a little extra money to spend, you could get decorative grab bars. If you just need the basics for safety, you can get regular grab bars. The key is to make sure they're screwed into the studs with long screws. And then some people get a walker, some people use a reacher. So these are just different things you might want to try in your, depending on your situation, to reduce your risk of falling. And then in the bottom right corner there, you see the emergency response option there. So it is really important that you have a way to call for help in the event that you do land on the ground and unable to get up to get to a phone. So people do this all different ways. I have had some people I know that have a system with their neighbor across the street. Hey, if I don't open my blinds by 7 a.m., come check on me. Something's wrong. And then if I don't close my blinds by 7 p.m., come check on me. Something's wrong. So there are neighbors that set up a system like that where they're checking on each other, making sure the blinds are open or the blinds are closed to signal that everything's fine. But if worse came to worse, they could be lying on the ground for a few hours before they're discovered. Some people will pay for a service like an I've fallen and I can't get up kind of a button that you can wear in the shower, or a watch that you can wear. Those are usually somewhere around $50 a month, but you have to double check, do they work outside of your home by GPS, or do they only work if you're within a certain distance of the receiver by in your house? So some of those work out in the community, some of those only work within a certain distance away from the receiver. Those are those buttons that you can wear in the shower or on your wrist, around your neck. Some people have started to use technology for this. So there's certain watches now that are out that have what we call fall detection. So, and they are hooked up to the cloud. And so I have met in the community a number of people that have invested in getting a watch that's connected to the internet that has a fall detection and can also call for help directly from their watch. So those are some different options depending on, but you want to make sure you have a way to call for help in case you would have a fall, or have a system that you have somebody checking on you regularly in case you fall and you're not able to call for help, that you're discovered within a few hours. I've met people and heard of stories of people that have been on the ground for days before they were discovered. And that's just obviously a horrible, horrible experience that we don't want to happen to anybody. So I want to let you know about San Diego County. We have community programs that are free for older adults in San Diego. If you go to the website healthierlivingsd.org, you can find out about the Feeling Fit Club, which is a free exercise program for older adults in San Diego. And it addresses the 4 key components of fitness I mentioned: balance, strength, flexibility, and endurance. They have DVDs they can send you from the county with an exercise band. So you can do the exercises on your own at home with the DVD and the exercise band, or you can watch it on TV. It's streaming on most on a local cable access station, depending on what cable provider you have. Usually at 8 a.m. and I think 1 p.m. It's streaming 5 days a week online on local cable. And then you can also go to a center somewhere around San Diego. We have live group Feeling Fit classes that you can attend for free. And those are fun because then you can make some friends and meet some people and kind of develop that group motivation to exercise. We also have in San Diego, we have what are called evidence-based programs to help you learn how to live healthy with certain chronic conditions. So we have healthier living with diabetes, we have healthier living with chronic pain, and we have healthier living with chronic health conditions. These are 3 different programs that are all evidence-based, where you'll work with a health coach to help you learn how to manage your diabetes, your chronic pain, or some other health condition in a proactive way. Because there's a lot more to managing your chronic health conditions than your doctor probably has time to talk to you about during your appointment. And so these free programs are designed to give you the knowledge and skills you need to effectively manage your chronic health conditions. We also have in San Diego County, we have free Tai Chi programs, which are more focused on balance. And so if you're interested in any of that, I did send Vanya some information about the healthier living programs in San Diego County, along with the home safety checklist handout. Those are all PDF electronic flyers that she can send out to you after we finish this talk today. So just to recap here, we've covered preventing falls with helpful tips in 4 categories. Speaking up, this means proactively working with your primary care provider to manage your chronic health conditions and your medications, as well as asking for referrals and making sure you're on the right supplements. We've talked about the importance that you keep moving. This includes selecting the proper footwear, even inside the privacy of your own home, exercising regularly to address your strength, your flexibility, your balance, and your endurance by yourself, with a partner, or in a group. And if you're not sure how to exercise, working with a physical therapist who can consider your medical and surgical history to develop a safe exercise program for you individually. We've talked about getting your eyes checked, going to see an ophthalmologist regularly if you have cataracts, macular degeneration, glaucoma, or diabetic retinopathy, or if you just need to be screened for eye diseases. We've talked about seeing an optometrist regularly to make sure your glasses are correct and being extra cautious if you're walking up and down curbs, steps, inclines, or stairs wearing bifocals, trifocals, or progressive lenses. We've talked about making your home more safe by increasing the lighting, decreasing the glare, being cautious around wet floors or throw rugs. We've talked about improving the safety of your bathroom with grab bars, sitting down in the shower, maybe using a walker if you need it, or a reacher if you need it, having a way to call for help in the event that you do land on the floor and unable to get up. And we've talked about the home safety checklist that our Fall Prevention Task Force offers for all of you to use to inspect your own home. If you're interested in more information from me, I want to let you know I do have 3 UCSD Stein public lectures available on UCTV. Taking Steps to Prevent Falls from 2016, Dizziness and Vertigo, Research on Aging, Part 1 from 2017. And that video actually has over 3 million views. And then Dizziness and Vertigo, Part 2, Research on Aging from 2018. So here's some more extensive public lectures I offered at UCSD. I also have a book out, as she mentioned, that you could check out if you're trying to navigate the healthcare system for relief of dizziness or vertigo. And you're always welcome to contact me directly with questions. So let's go on to the questions slide. And that was the contact information for the San Diego County Fall Prevention Task Force. So Vanya, please back up to that slide. Sorry, I forgot that was there. So this is if you want to talk to the San Diego County with suggestions for the Fall Prevention Task Force or questions, or you want a speaker to come out to your community where you live, or a senior group that you're part of, and you want to have a speaker come out to talk about preventing falls, or you want to have a health fair and have someone come out and do balance screenings for you and your friends, you can contact the San Diego County Fall Prevention Task Force. We do have a bureau of speakers that go out in the community talking about these topics, and we have a bureau of people who are trained for balance screening out in the community. So you can check that out. There's the phone number, the email, and then you can go to sandiegofallprevention.org to access that information and additional resources online.